Zoom, so you'll see that on the bottom of your screen. Click on that, type your question in, and we will read it for you. If by chance you're on the phone, you can press *9 on your phone. That will raise your hand and we'll call on you to ask. We expect a lot of questions today, so we ask you to keep your questions short and succinct, and we'll get to as many as we can. If you're on YouTube and you have a question, or if you have a question that we don't answer, you can certainly ask that at our email address, healthinfo@bouldercounty.org. And with that, I'm going to turn it over to Jeff Zayak, Executive Director of Boulder County Public Health.
Thanks, Mike, and welcome everyone. So happy that you all are joining us again this week. As you know, last week we spoke about schools a little bit more, and we are back to our favorite focus, which is vaccine. So I will do a short update on data, and then I'll turn it over to Chris Campbell, who will talk more about where we are at with our vaccine. I told Chris a couple weeks ago that he was probably going to be a person in high demand, and that is clear. We do expect to continue to provide updates on vaccine. We know that's on people's minds, and we're getting a lot of questions. So again, appreciate you all tuning in today. So I will share my screen and start with an update on the data that we have now. And our picture for data, I will just give you the preview, looks pretty promising. We still have a few more days before we know the picture for sure, but the data that I'm going to go through is looking pretty good for us here in Boulder County. Let me minimize this screen. All right. So this is the first slide I wanted to start with. This is the state dial. As you all know, we're in orange at this point. We have one indicator that is not in orange, and it's our Boulder County 2-week cumulative incidence rate, which has been slightly above 350, which is the break line between orange and red. We've been hovering in this range for the last week or so. But our data is starting to come down, as you'll see. Our other two indicators, our 2-week average positivity rate is in the green, and our declining or stable hospitalizations is in the orange. This is the metro area, and you can see that we've had a spike, and we know that that spike has been associated with primarily Christmas, and we are expecting that part of that was New Year's. But it does not appear that we're having a significant spike associated with New Year's yet. Today is the 13th of January, and we're waiting till about the 15th or 16th to see if there's any other delayed reporting associated with that. But we do expect that our numbers will continue to decline, and we're hoping that that in fact is the case, and this is a good start to that right here. This is our 5-day average number of new cases of COVID-19 in Boulder County. Again, here you can see a downward trend. This is our 2-week incidence rate of new COVID-19 cases in Boulder County that's broken out by age groups. And you can see that most all age groups have pretty much flattened out here, with the exception of a couple little bumps. But we hope that this again continues. It does look like we're stabilizing, and again, we're hoping that that will continue into the next few weeks going forward as more vaccine gets distributed. This is our positivity rate, and ever since roughly around the 16th or 17th, we've been below 5%, which is our target number. Ideally, if we are below 5%, we are doing enough testing in our community to make sure that we are identifying where the virus is. And we have remained below that number. What's important to point out here is that this is our 5-day rolling average versus the 2-week rolling average that I showed you on the dial in that first slide. This is our hospitalizations in Boulder County, and as you can see, it's on a nice, pretty steady decline. Again, we hope to see that continue. We know that our hospitalizations come in a delay of about 16 days after we see case increases. And then our final indicator that we see increase is unfortunately deaths. But you'll see that deaths is also decreasing in our county. It's unfortunate that any of these deaths have occurred, as we all know, but we are happy to see that we are on a declining trend. And again, we hope that that continues as we move forward. And this is the last slide. I just want to highlight again that we still have an estimated infection of 1 in every 102 people, that's still much higher than the infection rate we had 3 months ago, 4 months ago now in the middle of the summer, which was more like 1 in around 800 to 900 people. So we still have a lot of infection in our community. We know that there's still a large percentage of people that have the disease and they don't know that they have it. They're asymptomatic. So please do take advantage of the free testing that we have here in Boulder County. This is especially important after gatherings like the holidays that we just went through, because people may not know that they have it. They may feel fine, but in fact, they do have the disease and can spread it. If you go to our website, Boulder County Public Health, COVID-19, and you click on the testing link, you can see where our testing sites are, the hours of operation. We have several locations that are free. You do not have to have symptoms to access that testing. Please do take advantage of it, as it is here in our community and available to us. And as you've heard me say week in and week out, we can prevent this. We do not want to let down our guard now. Vaccines are being distributed, as you're going to hear from Chris in a second. But we can't stop thinking about those prevention strategies of making sure that we're wearing our masks, that we're remaining 6 feet apart, that we're not doing large social gatherings. The more we mix households, the more people we bring together with 1 in 102 people in our community infectious, the more chance we have at spreading this disease in the interim until we get our vaccine out into the community in a much broader way. So please do keep up with the prevention strategies. It will help us make sure that we can keep our businesses open. It will help us make sure that we can have our kids back in school, which we all know are so important to our economy, quality of life, and our health. The last thing I'll say is if you haven't done so yet, please go to addyourphone.com. It is an app that you download on your phone. It will let you know if you've been in proximity with somebody who's a known positive COVID case, and it will send you instructions in terms of what you should do as a follow-up. So with that, appreciate everybody being here, and I'll turn it over to our very most important person, Chris Campbell, who will talk about vaccines.
Okay. Thank you, and give me just a moment here, everyone. I'll get my screen shared and we'll jump into a good presentation. Okay. Good afternoon, everyone. My name is Chris Campbell, and I am the Emergency Management Coordinator with Boulder County Public Health, and also a vaccine lead working with the wonderful team in Boulder County on our vaccine administration plan. Thank you for the opportunity to present this afternoon, and so great to connect with all your community members. Just to go over some of the objectives we want to share with you today, some of the things we'd like to accomplish. We want to give a good picture for the community to really understand where we're at with vaccine availability and really how limited vaccine, how much vaccine is really available to the state of Colorado and to the Boulder County community. That's very important to discuss, just to really give some transparency and understanding about when vaccine will be available to certain community members. So we'll discuss that a bit. General just situational awareness about how many vaccines have been administered in the county and in the state. And we'll talk quite a bit about our current planning efforts, how we're going to implement administration in the county, and really talk about how all the collaboration efforts we're doing out there to safely and equitably provide vaccine access to community members. And certainly we'll answer questions as well for community members. I just wanted to talk a little bit about the statewide phased vaccine distribution plan. And one important message here for the community is this is a statewide plan. This is a plan that the Colorado Department of Public Health and Environment and the Governor's Office have put into place. Boulder County Public Health cannot step outside of this phasing. In fact, as a vaccination provider in the community, if we, for example, move on to phase 2 tomorrow, there's a chance that we would lose our ability to receive and provide vaccines. I just want to be very transparent and clear with the community that we're really unable to go against the phasing. We work on a daily basis with the leadership and with the state health department, with all their wonderful people in their immunization branch to really understand this phasing and inform it. But it is really something that we have to stick to as a community. So we're diligently moving through this phasing plan. To mention where we're at with some of the 1A phasing with healthcare workers, frontline healthcare workers, long-term care facility staff. We still have about 5,000 community members in those groups that we're working through, in addition to those first responders. So the group knows we have also about 30,000 community members that fall into that 70+ category. So we are going to diligently move through these groups. We'll talk a little bit about how we're doing that. And I did want to just additionally mention, so the community to really understand from the very beginning, we knew we were going to be in this phase of very limited vaccine availability. And that's where we're at right now. So we went through all the wonderful phases of looking at the vaccines, getting them approved under emergency use authorization, and going through those very rigorous processes. And the vaccines started rolling out. We are in our 5th week of this vaccine endeavor nationwide, and that's very early on in the stages. Just to let the community members know, currently the statewide allocation, the state of Colorado gets about 60,000 doses of vaccine on a weekly basis. And what that means is it's about 30,000 of the Moderna vaccine, about 30,000 doses of the Pfizer vaccine, and that is a very small amount. And currently, 20,000 of those doses are going to the National Pharmacy Partnership. So that is groups of long-term. These are long-term care facilities, assisted living facilities in our community. Their staff and residents are being vaccinated in that 1A group. That is ramped up. We're very excited about it. It took a little while to ramp up. And so that only leaves about 40,000 doses for the entire state. That's our current vaccine allocation. And it really is a pretty small number right now. So we just want to be transparent with the community that we anticipate that more and more vaccine will become available. We're just not quite there yet. I can also say that we have 30 enrolled providers in Boulder County that really have a lot of capacity to get vaccine out to the community. We just need more vaccine. So we will get there. Okay. And just wanted to share some additional, just to kind of give some context and frame again where our vaccine numbers are at. So these are statewide numbers, and in that phase 1A, we have a total of about 187,000 community members that fall into that phase 1A. So these are high-risk healthcare workers, long-term care residents and staff. As you move into that phase B, including our wonderful community members that are 70+, and also including that phase of frontline essential workers, those numbers are very big. So that's about 1.3 million Coloradoans. And to date, just to frame this, the state has only received 282,000 doses of vaccine. So we have a little ways to go, and so the messages today is just a little bit more patience from the community and understanding. We anticipate again that ultimately anyone in the community that wants a vaccine will be able to get a vaccine if it makes sense for them. It's just going to take a little bit longer. And we are anticipating that, as additional vaccine candidates come online, we will have more and more vaccine available to community members, and we're building those structures now to be able to safely and equitably get that out to community members. Just to talk about where we're at currently with the administration of the vaccine. So about 200,000 people in the state of Colorado have received that first dose of vaccine. About 40,000 have received the full, both doses and the full course, which is wonderful. That's again where, as we start to get more and more community members having that full course of vaccine, we we start maybe potentially moving that sense of normalcy, that light at the end of the tunnel, where more and more of the community is vaccinated and safe. We're making progress in Boulder County as well. So about 12,600 community members have received vaccine in these early weeks. And we're just now moving into that phase where folks are getting the second vaccines. These are a lot of the first, these are some of the first frontline healthcare workers that received the Pfizer vaccine at our wonderful hospitals in the community. So there's about 2,000 community members who received that second course. And just to kind of frame the kind of how we're rolling it out on a daily basis, the vaccine. This really, what I wanted to show with this slide is just, and it might be tough to see on the screen, but we anticipate that these numbers are going to continue to go up, and the weekly distribution will be doing more and more vaccine on an everyday basis as we build capacity, as we bring partners on that are vaccinating in the community. But we just want to share the screen to show kind of our weekly and daily output. And I definitely want to mention our wonderful partners in the community. So we are partnering with all the hospital systems, all the hospitals in the county. We are working with the Federated Qualified Health Centers, so Clinic on Salud. We have partnerships with CU, and they are starting to ramp up their infrastructure, and they're going to start providing vaccine to the community. We're working with Safeway pharmacies and King Soopers pharmacies are coming online, and Safeway is vaccinating community members. King Soopers likewise will be starting to vaccinate community members next week. So that is all. I just wanted to kind of mention that to the community and really recognize the incredible work of our partners across the board. It's really going to be an all hands on deck effort to get vaccine to community members. So and just to kind of get some transparency on the vaccines being allocated to those partners. Hospitals and large health systems were some of the first to start receiving vaccine and are doing incredible work to get vaccine out to community members. So they're getting quite a bit of vaccine right now. Our clinics in the county are also receiving vaccine, and our Boulder County Public Health is also doing some vaccine clinics, 1 to 2 a week. And so we're receiving vaccine and getting that out to frontline healthcare workers and essential workers in the community. And our goal continues to be to increase access to community members. So the state, and we're adding partners on working very hard to continue to add partners that are able to vaccinate in the community. The state is working to bring on even more pharmacies in the community, and they will be available to help and support the vaccination effort. As we mentioned before, we're matchmaking, and so what we're doing is we're working diligently through these phasing and working with community members, matching them with hospitals, matching them with the pharmacies like Safeway, matching them with the clinics to get vaccinated. We are working to staff up on the public health side to provide even more clinic options. And we are meeting on a weekly basis with our providers to ensure that coordination's there, the communication's there, the clergy's there for community. When vaccine is available to them, here's the options, here's how they will go and get vaccinated. And we do want to talk a little bit about the additional phases. I know that it might be a little hard to see here. So basically in the vaccination plan, there's a large group of community members. And I think you saw those statewide numbers of 1.3 million. We are really planning to ensure access to community members as they fall in those groups. So these are frontline essential workers in education, manufacturing, workers, grocery workers. And so we know that is a very large group, and we are really going to have to scale up in our community to provide vaccine. So we're looking at potential large scale points of dispensing. And some of you might have seen that LA County, they're starting to look at a 24-hour, vaccination clinic. Something that we might not be doing something like that, but we know that in order to provide enough access and enough vaccine to community members, we're really going to have to scale. Everything we're doing is through a health equity lens. So we want to remove barriers. We want to communicate well with community members, connect with all community members, and ensure they have the information they need to access vaccines should that be something they want to do. So that's some of the longer term planning we're doing right now, and to ensure that our community is ready to go as vaccine allocation starts to increase. I would just like to remind the community, and we can certainly answer questions around this. We have a couple links on our site where members can sign up, and they will be able to receive a notification with information about how they access vaccines. So we encourage the community members to go there. Just to be clear here, you're likely not going to receive a notification for a while if you're in a phase or with a group that's going to take a little while to get to. So just be patient. We will continue to communicate in these community forums, and through press releases. You will not be skipped or missed. Our goal again is to work with every community member and provide as many options for them to get vaccinated. So we do encourage community members to go ahead and get signed up here. And I just wanted to just really reiterate Jeff's message of where we're at. So I think you get a sense of how really where we're at in terms of vaccine allocation, how much vaccine is available to our community currently, and we need to continue to focus on those things that we know work to keep community members safe right now. And so again, please consider no large social gatherings, distancing as much as possible. Really encourage everyone again, if they have not gone to add your phone, to certainly go there, so you could be notified of a potential exposure. And this is a light at the end of the tunnel. So we just appreciate everything the community is doing to keep everyone safe. It's up to all of us. And we'll continue to come to these forums and give you updates in the future. Thank you very much.
Okay, thank you, Chris. We're now going to open things up for questions. We've got quite a few questions already. We will answer as many as we can. Our presenters are approaching these topics from a place of respect, so we ask that you please do as well. We'll be using the Q&A function at the bottom of the Zoom screen. Click on that, type your question in. I'll read that out for you and we'll get an answer. If by chance you do not get your question answered, we've got quite a few and we may not get past the vaccine questions, please send an email to healthinfo@bouldercounty.org. Keep your questions short so we can get to as many as we can. If you're on the phone, press *9 to raise your hand and we'll call on you to ask your question yourself. And with that, we do have one more person here to answer questions with us. That's Dr. Chris Urbina, Boulder County Public Health Medical Officer. So with that, let me start with some questions. We'll start with a simple one. If I get vaccinated, does that stop me from spreading COVID to other people? That might be for Dr. Urbina.
A great question. Two vaccines that are currently available are the Moderna and Pfizer vaccines. Moderna actually asked this question of our clinical trial participants, and they've shown that that vaccine does prevent the infection. But most importantly, it infects the serious complications related to the infection if you get it. Pfizer didn't show that, but it's likely that it also prevents the infection. But remember, no vaccine is 100%. So when you talk about the effectiveness of the vaccine, 95% means that the majority of people who got the vaccine were prevented from getting the infection. So that 5% still had a chance of getting the infection. So that's what we know now. 95% is very good. When you look at a flu vaccine on an average year, the effectiveness is about 50%. So this is a very good sign. It shows good promise for these vaccines. And as more vaccines are rolling out, hopefully they will be as effective as these two.
Thank you. Question here, probably for Chris. I'm not enthusiastic about increasing the time between dosages, which is against the science that I've seen for the most part, because of a supply shortage. Can we count on Boulder to not do this? What do we think about supply shortages there, Chris?
Yeah, I think another good question. I think this might be the consideration of you're not doing a second course or a second dose, and right now everything we're hearing is that we will be doing the second dose, and that's not going to change. I think what you might have heard recently is there's a decision to maybe roll out all the second doses of the vaccines and be held back to ensure that that second dose is available. It sounds like there's confidence that there will be a consistent vaccine supply. So everyone is going to receive that second dose. It's crucial to work towards that efficacy we need with both the vaccines that are out there right now.
Okay, thank you, Chris. I'll keep you on the hot seat here real quick. What measures are you taking to ensure that vaccine is not wasted once it's thawed?
Thank you, and another great question. Yeah, we have an incredible team. Our immunization team, including Betty Tovar, are very experienced with handling vaccine, and we have a really good process in place for basically understanding the usage and how many folks are coming for clinics, and we really are pretty clear on how many. We are doing a sign up. We're doing a sign up as well, so we know approximately how many folks are coming to our clinics, and we're able to manage how much vaccine we thaw and how much vaccine is available. So there's very little vaccine. We haven't wasted a single dose of vaccine to date. So I would like to recognize that team, and go ahead, Dr. Bina. Looks like you want to weigh in there as well.
No, I think you're right. And I think we've also assured that with all our providers out in the community, because they've done very similar things. That this is not only true for our health department, but all the hospitals and primary care sites that are also doing the vaccine. They have a call down list, because we obviously have a short supply of the vaccine, as Chris Campbell has mentioned it. We're not wasting a single drop.
Thank you, Dr. Urbina. Question here about the hospitals. Why do you allow hospitals like BCH to give vaccines only to patients who go to employed BCH providers? We need better access for everybody.
Yeah, thank you. It is a great question, and we have talked with all our providers. We had a meeting today about that, and it's our understanding that additional providers are coming on, and they're going to provide vaccine to any community members, regardless if they're affiliated with their hospital or with the clinic. So you're going to hear more and more from us. Again, for those that have signed up with us with Boulder County Public Health and are in the phasing and fit within the phasing plan, you'll be hearing from us very soon to be matched with a provider. So we know some of the hospitals, are initially working with patients that are affiliated with them. There's lots of providers out there, including the pharmacies, the clinics that are willing and are going to be vaccinating all community members.
Can I add to that? I just wanted to share that I did pass that concern up to the state health department today, and they were unaware, they said, so that they were going to follow up on it. But I just wanted to pass on that we are continuing to share that concern.
Thank you both. Question asking, excluding the shortage of the vaccine, why are institutions just now figuring everything out? Haven't we known that vaccine would be coming in slowly at about this time? We know it's been an ongoing situation that's constantly changing, but could you tell us a little bit more about that, Chris?
Yeah, it's a good question. I think that's where the slide that I did show, talking about this initial period of limited vaccine, is one we have opened up every discussion. Every time we share about the initial vaccine rollout and plans, that's what we anticipated. And so, I think the challenge has been communicating that well to community. We know that there's been some shifts directly from the governor's office that have brought additional groups on, and additional large groups like the 70+ group. And so that did change things. That opened it up for a much larger group of community members who could potentially access the vaccine with a very limited supply. So, we have known that. And again, I think that's why we just want to ask the community and be transparent with you that we're going to be in this stage for a little while longer. And so we're going to diligently move through the phasing, provide vaccine to folks based on the statewide vaccine plan. All the guidance is coming from the CDC as well, and really look towards those phases where more and more vaccine is going to be available. We're going to be ready to go when that happens.
Thank you, Chris. Here's one for Dr. Urbina. We currently require our home care workers to be tested weekly. Do our staff who have received the vaccine need to continue to be tested?
Great question. Those are things we're trying to work out right now. Theoretically, after the second dose, 1 to 2 weeks after you get the vaccine, you're going to be protected from getting the infection. So as we are fully vaccinating folks, I anticipate that new guidance will come out regarding testing of healthcare workers and particularly home healthcare in long-term care facilities. But we're not there yet. Those are guidelines that are still in development by CDC. I'm hopeful that they will adjust those testing guidelines, because as we vaccinate more people and people have natural immunity, we'll have the virus less commonly in our community. But it is still possible that you can get the infection after you get the vaccine. Now, I guess I just didn't understand the question earlier, and I'll just continue with the answer to that question. You don't get the infection from the vaccine. The vaccine produces antibodies and increases your immune system to fight off the infection. It is still possible that you can get the infection. So if you do get the infection, yes, you can pass it on. But the idea about getting vaccinated is to prevent you from getting the infection. So, and I think that the final thing I wanted to say about that is we're still going to be going through this period of time that Chris Chris Campbell and Jeff Zayak mentioned, is that we're still going to have to wear masks. We're still going to have to be physically distancing, to avoid large groups, to washing your hands and disinfecting places while we try to scale up our vaccination. So you're not out of the woods yet. You should still be doing all of the protection activities that we're talking about until we get more people vaccinated.
Thank you, Dr. Urbina. This one might be for Jeff. It says, why are states differing so much on their vaccination phases? I know friends who are in different states, same age as myself, who've already been vaccinated. Can you talk about that a little bit, Jeff?
I actually will defer that to Dr. Urbina if he knows the answer to that question.
You're
Can you
muted.
repeat the question, please?
Yes, we know that different states have different phases on when people are getting vaccinated, sometimes different ages, et cetera. So do we know why that is?
Sure. It is simply this. We didn't have a national strategy. The only national strategy that we had at the federal government was to produce the vaccine and distribute the first doses. Then the federal government said, now it's up to the states to decide how they want to distribute. So because the guidelines that came out from the Advisory Committee on Immunization Practices, a component of the CDC, said, these are the general guidelines, the state said, well, we're going to take this vaccine and decide how we want to do it. And so that's the part of the, unfortunately, the confusion that the states and then passed on to the local health departments are dealing with, is that we didn't have a national strategy at first. And so states were allowed to do whatever they wanted to do. And so that's why states have chosen to do that based on what the governor and the health departments at the state level are doing. And that's unfortunate because that does create a lot of confusion. And that's what's so frustrating. We're all frustrated by this. And I want to, my dad who's 93, as a personal story, he's still waiting for his vaccine. How is that possible that a 93-year-old guy is still waiting for his vaccine? So you're not alone. And I wanted to say that Chris Campbell and our health department and our providers are working very hard to try to answer this question. And we've scaled up, we've done tremendous work, all collaborating together. And as we get more vaccine, I think you'll be happier that you'll get your vaccine when you can get it. And that's our hope. But I know it's really frustrating. I just want to say how we feel your pain. And not all of us have been fully vaccinated yet, and so we're still waiting for our vaccines as well. So you'll be hearing more from us as we go through.
Thank you, Dr. Urbina. This one is for Chris Campbell. Will people who have medical conditions making them high risk need a certificate from their doctor, or how will they access vaccinations? I think that's probably also true of age, your occupation, et cetera. Can you tell us how that works?
Yeah, thank you. Yeah, it's a good question, and one that I think there's several options here. So just to be transparent, we're not checking IDs at our testing sites. We are really relying on folks to be honest when they sign up. As we move into those other phases where we talk about comorbidities or underlying health conditions and being, having access to the vaccine, again, I think it's going to be a screening tool through many of the providers where they're going to ask some questions and see and answer those and see if you do actually qualify. So I think as you see us moving into these next phases, will be depending on the provider you go to, they will ask some questions. I doubt that they're going to ask for any kind of note or anything like that to verify your condition. Again, the most important thing for us is to get as many people vaccinated as possible, and we're relying on community members, to be honest and to wait their turn. We'll do vetting as possible. We know folks are going to slip through, which is okay. I think it's one we're talking with our providers about, and really do believe that we'll have good systems in place to be clear on how folks can access vaccine.
Chris, before you go, let me, a similar question. People are asking about, do you have to prove that you work or live in Boulder County to get a vaccine?
You do not. And I know there's just to let the community members know that are joining, there's a lot of coordination that goes on in our region and between other counties. Again, we're not throwing up barriers. We do encourage you to, if you're employed in a county and it's a large employer, to go ahead and get vaccinated in that county. And if you work in another county, you could certainly get vaccinated there if you live in Boulder County. So there's no barriers there, and the most important thing is to get folks vaccinated.
Thank you, Chris. Here's a logistics kind of question. It says 30 plus providers in the county sounds awfully complicated. Wouldn't it be better with a more centralized approach like New York City and Los Angeles are doing with very large stadium-like clinics? Will that be necessary here in Boulder County?
I think it's all the above, and I did mention that. Again, to do this on a large scale, it's all providers. So some folks are going to struggle to access vaccine in these larger mass vaccination clinics. There's transportation barriers. Some folks are more comfortable to go to a hospital setting. The clinics, are a smaller setting, and they know community members well, and community members are comfortable with going to clinic or salute. So we actually feel that that's a good approach to give folks lots of options and to bring many providers on. And we're coordinating with them as we move into even larger scale. We're confident that all these providers have the information they need, and they're going to be able to provide vaccine on a wide scale. And we are looking into, as I mentioned, some of those larger scale vaccination clinics that are going to run for several days throughout the week.
Thank you, Chris. Dr. Urbina, this is definitely for you. When will doctors and our hospitals be allowed discretionary vaccines so that young people with severe medical conditions can get them vaccinated?
I wish I knew the answer to that question, because clearly there are a lot of people that are in need of the vaccine. We know that people over the age of 70, people actually over the age of 65 are at greatest risk of complications, as well as young people with chronic medical conditions. We're going to be working with the state to look at those questions. Because we're required to follow these guidelines that the state has developed. So we'll take that question back to the state to say, we're getting this question at our community level. How can we open this up? So we hear you loud and clear. I understand the reasons why immunosuppressed person with cancer or type 1 diabetes might be at greater risk of having complications. So we'll bring that question up. And so hopefully we'll continue to provide that information to you as we go forward.
Thank you, Dr. Urbina. This is a question about second doses, which has been touched on, but maybe you could talk about it again, Chris. As people who have been vaccinated early come up on their 2-week timeline for their second dose, actually, I think it's 3 or 4 week, depending on the vaccination, will there be enough vaccines to go around for the second dose?
Yeah, I believe so. And, again, we're going to continue to monitor that, but every understanding we have right now is absolutely there will be enough vaccine for that.
Thank you, Chris. We do have a compliment today. It says, I received an email today from Boulder County Public Health. Thank you. It's good to hear some of those. Here's a logistics question. I don't know if we have an answer for that yet. How can people without email addresses sign up for vaccine notifications? It's a barrier for some folks, and including some higher risk groups.
I guess I'll take that. So anyone can sign up for notification, which does require an email address. However, that is not the only way that we will be telling people when they're able to get the vaccine. So we will be sharing information through community groups, in media, in social media, flyers posted. So we will be blanketing the community in many different ways. So if someone's not signed up, it doesn't mean that we're not going to notify you. It's just if you prefer to get an email, you can sign up. Thanks.
Thank you, Jana. Dr. Abita, probably for you, this question: if my parents both get vaccinated, is it safe to visit them once the full efficacy of the vaccine has taken effect?
I would say yes. The vaccine is 95% effective 1 to 2 weeks after they get fully vaccinated. But I think during this period of time, I don't know your status in terms of your infection. I would just caution you to continue to be physical distancing, wear your mask during this period of time. I think the vaccine is not 100% effective, but as we increase the immunity up to a level that we feel like the virus is no longer present, then I think we can reduce those restrictions. But I think it is safer to visit your family members when they've been fully vaccinated.
Thank you, Dr. Urbina. Chris Campbell, another one for you here. You did touch on this a bit, but says that 60,000 doses per week, it will take roughly 21 weeks to reach phase 1B. We've got a number of questions that are basically asking about timelines. I know we don't really have timelines, especially as we go farther down the priority scale, because we don't have the vaccines to make sure we know when people are going to get vaccinated. But could you touch on that a little bit again, please?
Yeah, absolutely. And another great question. And I think you probably heard me not put a whole lot of timelines out there. And full transparency, I'm doing that for a reason. There's a lot of unknowns. I do think we can anticipate in the next 2 weeks a significant amount more of vaccine that will arrive in Colorado and in our community. So those timelines will move up, and we are going to start to get through these groups. I do have faith in that initial graph I showed, where we're going to be in this constrained environment for a while, and we are anticipating to be more and more in vaccine for our state and for our community. We also know there's other vaccine candidates out there, like the Johnson & Johnson vaccine, that could potentially also help improve or increase vaccine availability to our community. So all the indications are that things will pick up. It's just going to take a little bit of time, and we'll revise those timelines for you as we know more. We'll be able to, I think, give some firmer timelines. You might have heard, for example, that the goal of the state is to get through potentially that 1B group towards March. So that's what they're talking about. And again, that's that group above that dotted line that includes the 70 plus, but is a little smaller group.
Thank you, Chris. You may have touched on this. Sorry if I missed that. In terms of transparency, the question is, do we know how many vaccine doses have been allocated to Boulder County, and what percentage of those have been given?
I don't have that number, something I can follow up on and we can share. I can be very honest with the community. We are not, there's not a stockpiling going on of vaccine. In fact, I think we have the opposite problem. I'll give a good example. One of our providers this week was ready to basically double their output. So they were getting 1,000 vaccines in their allocation. We asked for 5,000 vaccines for next week, and they only got 1,000 vaccines again. So it's not an issue of us having vaccine and not getting it out and administered in the community. It's actually, we, again, are in this constrained environment where we don't have enough vaccine. We have the infrastructure in place, and providers are waiting, and we're advocating to get more vaccine.
Thanks, Chris. There have been a number of comments out there about CDC has said 65 and up should be vaccinated early, not 70 and up. Do we expect a change here in Colorado? What's the status on that? Probably Dr. Urbina.
Chris, I think you know the answer to this. Could you take this question?
Yeah, thank you, Dr. Bina. Yeah, it is our understanding right now that the governor is going to wait. So we're not making any changes right now to the phasing plan, and we're going to assess and really start to understand more what the vaccine allocation is going to be. Again, if you continue to add groups or community members, again, you just do the math. It's really challenging to provide vaccine to those large numbers when we don't have the vaccine allocation. So my understanding is right now, and maybe Jeff, you could also weigh in here, is we are not making any changes, and the state is seeking additional clarification on vaccine allocation to meet that need, and then those shifts to additional community members.
This is Jeff. That's correct, Chris. That's what I heard in the meeting that we had today with the state.
Okay. A few questions about signing up for vaccinations. We know that we're not able to start doing that yet. Hopefully we'll get more vaccines and can do that. But there are hospitals that are doing some things. There's different medical centers, et cetera. What should people do? Should they sign up for multiple notifications? What should their best option be at this point?
I can take it. So I hate to say this, but if you really want to make sure that you're going to get notified whenever there's possibly vaccine available, I would recommend that you sign up at all of the places that are offering sign up. You can also sign up with Boulder County Public Health. I put that information in the Q&A, and we'll notify you when we know about other places. So unfortunately, I think your best option is to sign up where you can, or just wait until we have more vaccine available. Chris, did you want to add anything to that? No. Okay.
I would say, if I can add something to that, Mike, and I know I sound like a broken record, but it's still important to wear a mask, to do physical distancing, to avoid large crowds while you're waiting for your vaccine. You can still protect yourself. In fact, all of those things that we've talked about so far are very protective. And I think ultimately not everybody will be able to get the vaccine or will want to have the vaccine at this point. So I think it's still important to do those prevention strategies. No reason to panic yet. You can protect yourself from getting this infection by doing the things that we've talked about.
Thank you. I think we have one more question before we have to wrap up here. What's going to happen when the students arrive at CU? What's being done for CU employees, staff, professors, et cetera? Do we know where that is, Mr. Campbell?
Thank you. Another great question. CU has been a great partner, and they, in terms of the vaccine administration, they're a provider and are ramping up their capacity. So in discussions we've had with the university and their staff, they're going to be, they're going to really focus on vaccinating, their own community members and work very closely with us to ensure that happens. Jeff might be able to speak a bit more to some of the plans around, as students come back on campus, if and when. That's something don't have a lot of information on outside of the vaccine administration.
I'm happy to, and maybe Chana could add here if I'm missing any pieces. We did meet with the university, both CSU and the University of Colorado yesterday to talk about plans for coming back. I think probably most everybody on the call knows that we have a pretty strong infrastructure in place already with the University of Colorado from the standpoint of making sure that prevention strategies are implemented with students coming back, testing is implemented with students coming back. There's both on and off-site testing when students come back, and they're coming back February 15th, I believe that is the date. And we also have the same infrastructure in place to monitor and support reductions of, collegiate gatherings and parties, which we know was the biggest challenge for us when students were here before. We have a strong relationship with the city of Boulder, with the University of Colorado, and we will have that same system in place again when they come back. Chana, is there anything else I'm missing from that?
I think you got it, Jeff.
Okay, and with that, I do believe we're out of time. I want to thank everyone for joining us today. We will have this posted to our YouTube channel. If you did not get your question answered, or if you have a new question, please email us at healthinfo@bouldercounty.org, and we'll be back next week. Thank you.